This presentation follows the previous discussion about what sleep apnea is and what surgical and non-surgical treatments are available for sleep apnea. Just to quickly summarize, sleep apnea is cessation of breathing, and it can lead to significant health concerns, in particular sleepiness and road traffic accidents. Cardiovascular or respiratory concerns may also be present. In some people who are snorers without sleep apnea, the main concern can be social. There are surgical and non-surgical options which has been described, and non-surgical options once again are CPAP devices, positioning devices, or jaw positioning devices. All those options are available, and your surgeon will offer these options if you wish to go down that path. If they're not suitable for you, surgery will be discussed with you. You'll be given a 5-page document along with the other information. This involves a preoperative pack. In the preoperative information, we outline that it's important that you inform the surgeon of any health concerns that you have, in particular any regional pain syndromes, any addiction to painkillers or other substances must be disclosed. You need to inform the surgeon of any bleeding disorders or blood thinning medications. You must make yourself stay close within the proximity of the hospital for 4 weeks after surgery, and do not travel away from the hospital because the bleeding can occur up to a few weeks after surgery. It's important that you take time off work and also have assistance at home. Post-operative care will be managed by both the surgeon and either his team at Frankston or in Peninsula Private Hospital by physicians or even anesthetists who will assist in pain management. The staff and the hospital nurses will assist in your care and advice. The pharmacist will guide through the medications as much as your surgeon and the physician. Therefore, your first night will be in high dependence unit for close observation. Thereafter, 1 or 2 nights in the general ward until we feel that you are safe to go home. Once you go home, you must stay with someone else who can assist you and not travel. If there's any bleeding, you need to present yourself to the emergency at the public hospital for assistance. Do not do any strenuous activity, and once again, all these are outlined in the post-operative instructions. The consent by this stage has summarized your condition, the diagnosis, the possible options available for you, as much as the risks of the procedure. Some details of the operation also has been described for your understanding. Any operation has risks. Once again, the surgery has advanced a lot, and we try and do the least invasive technique. Despite this, there will certainly be a lot of pain. The pain is due to tonsillectomy as well as lifting the muscles up. The muscle tear itself will be very painful, and you will require sufficient pain relief before you go home. Small risk of infection is there. Small risk of bleeding or even small risk of hemorrhage that requires you to go to the theater may be possible. Therefore, do not travel. Risk of a life-threatening event is exceedingly unlikely and less risky perhaps than driving your car on a very long road trip. Emergency airway surgery is a very rare possibility. Those risks are once again very, very small. Injury to the teeth and surrounding structures, or even injury to the tongue nerves or muscles, in rare occasions are possible. But we reduce these risks by going on predetermined surf channels done over the years. We go through researched, guided safety pathways to try and improve your outcome and reduce the risks. Some risks cannot be predetermined, but we do our very best to minimize this by all the explanation and the surgical pathway we are giving you. Once again, we hope that you understand the diagnosis, the other possibilities of treatment, as well as the risks and benefits of surgery. If any questions, please ask your surgeon. Once you're happy, you will sign the consent form and obtain the information sheets that you require. If you wish to not proceed with the surgery, please inform the surgeon. Signing the form does not mean that you must proceed. You can always cancel and inform us. Thank you.